Good evening. Thank you for joining us tonight for our 18 News digital exclusive State of the Virus. I'm George Stockberger. Now, the COVID-19 vaccine is available, but supplies are limited and people have a lot of questions about where to get it. So with all those questions remaining, 18 News is asking you, our viewers, to give us questions to ask your local experts regarding COVID-19 and the vaccine. And today, once again, we're joined by Dr. Michael Scalzone, the Chief Quality Officer for Guthrie. And thank you for joining us again, Doctor.
You're welcome, George.
All right, so Dr. Scalzone, we've talked in the last week about the numbers appearing to drop in our community. And this morning, the governor lifted the orange zone restrictions in Chemung County. But what are you seeing in the hospitals right now?
So we're seeing that same trend overall, which is very, very nice to see. We expected this a little bit. Typically, the hospitalization rate trails the positivity rate by about 2 weeks. And as it's been going down in our community, as you said, moved out of the orange zone because the positive testing rate has gone down. We're seeing that in the hospital. So we are starting to get a little bit of a breather.
All right, that's great to hear. Regarding the vaccine, we've had a lot of questions about this. Julie in Bath is asking, getting the vaccine seems to be impossible as a 65-year-old with underlying conditions. Where should she look to get the vaccine?
Well, that is a terrific question. It does feel impossible because it is very, very difficult. The site to get access is still the New York State website to check eligibility, because they will then drive you to the areas where there are appointments available. And as most people have learned, those appointments fill up very quickly. And whenever there are local vaccines available, that's the methodology for people to go to be able to get it. It is difficult, and it will probably remain difficult for weeks to come.
All right, and since it is so difficult, Sally in Elmira is asking, how are the hospitals and the vaccine sites prioritizing who gets the vaccine? Are the people who are in Group 1A being prioritized over the people in 1B?
So the majority of people in phase 1A have already been vaccinated if they chose to be. So there are very few of those individuals left. However, the state is pretty clear. If someone who is phase 1A requires vaccine, we should prioritize those over 1B.
All right, and Dr. President Biden has pledged to administer 100 million doses of the vaccine in his first 100 days, and that would be in late April. Is that a realistic goal to set, given how slow the rollout has been so far nationwide?
Well, I think if you look what's been coming out each week, that's still going to be an escalation to be able to get there. But I do think that given the fact that we are going to get another 10 or 15% per week, according to the federal government, that I think it's very doable. So I'm hopeful. That would be a significant number of individuals vaccinated. If you think about the 25 million that we've already had, unfortunately, be infected across the country. And then when we know that there's a pretty significant number of people who were infected, either asymptomatic or minimally symptomatic, and actually were never tested. So that would really be very significant in controlling the spread of the virus.
All right, Doctor, we have another viewer question, and this viewer asked one that we've had a couple times before. But can you get the COVID-19 vaccine if you've already had the virus? And is there a time frame you need to wait after recovering from it?
So there are two important points to that question. I'll start simply with yes. You can get the vaccine after you have fully recovered from COVID-19. So you should no longer be symptomatic or certainly not in quarantine. Initially, it had been suggested that people wait 90 days following an infection before they get vaccinated. That's no longer required. If your symptoms have resolved and you're out of quarantine, you're eligible to be vaccinated. We don't know if natural immunity from the infection is as good as being vaccinated. When we look at studies of the antibody response, the body's response to the virus, there are higher levels of antibody with the vaccine than there are typically for someone who had a natural infection. So we make an assumption that that might be additive protection. And because of that, that's why we recommend that even if you've been infected with COVID, if the vaccine is available to you, it's a wise choice.
We've also seen a couple cases here where people have gotten their first dose of the vaccine, but they've still tested positive. We saw this in one local nursing home in Chemung County. Is there a reason to be concerned about this, or is there something normal that we see with other vaccines?
We do. We see that with other vaccines. It's possible someone could have the flu before they get a flu vaccine. And we've seen this as well. It was seen in the very early trials of the vaccine. We've seen it in our institution as well. It doesn't impact the effectiveness. There's good science to suggest that. There are times when people have a stronger reaction because they are actually not reacting to the vaccine, but they're demonstrating symptoms from having COVID. And given the fact that we know that there's a significant asymptomatic population who are going to test positive, this will continue to happen. But there's no risk involved, and we believe the protection will be the same.
And we've also talked about allergies and reactions to the vaccine before. Joy and Aaron asked, if you were not able to get the flu vaccine because you were allergic to eggs or feathers, will you be able to get the COVID vaccine?
Yes, very clearly that those kind of reactions, if you have an allergy to foods, to environmental aspects, even bee stings, something like that, it's still safe to get the COVID vaccine. So that is not a contraindication. Even if you had a severe allergic reaction to some of those things, we still believe it's safe and recommend getting the COVID vaccine.
We also got a lot of questions about quarantining. Angela in Covington asks, do I have to quarantine if I become a close contact with a positive case, even if she has already had the virus?
So we don't know about reinfection. It seems to be very rare at this point, but we don't know for sure. And so the final answer comes down to the public health department and whether their recommendations are to be quarantined. But given that very small chance that someone could be reinfected, I think they've been recommending that they do.
All right, and a similar question, if you receive both of your COVID vaccines, do you still have to quarantine before you travel?
The answer to that right now is yes. So that will be evolving as more and more people become vaccinated. But we know that vaccine is not 100% effective. And the requirement for a negative test before entering the country that was recently put in place, being vaccinated does not count as a passport, so to speak, to come into the country. You still have to demonstrate a negative test within the 3 days.
This week, Dr. Fauci said that wearing two face masks is likely to decrease the spread of COVID. Is that something, doctor, that you would recommend that people start to do, is wearing two face masks?
So I think there's a couple parts to that question that are important to sort of unpack. The first is, for cloth masks, we've always recommended that they be at least 2 layers because unlike a surgical mask, they don't have that same level of protection. Intuitively, 2 masks are going to be a better protection than 1 mask. But one of the thoughts here is the reason that the second mask is more effective is that it's a better seal, and that 1 mask can sometimes allow more air and more respiratory droplets to be expelled. So 1 mask with a good seal is really important as well. We're not at the point where we're saying everyone should wear 2 masks, but we do think 1 regularly worn, well-fitting mask is important.
All right, that's great information. And another viewer question here from Ronald in Elmira. He asked, will COVID-19 be a recurring virus such as the flu, and will people have to get vaccinated every year?
So this is a question we'd all like the answer to, and we don't know just yet. What I can say is we know that the flu shifts each year. So the spike protein, as we see on the coronavirus, a flu vaccine has similar antigens on its surface, and they shift each year. And that's why a new vaccine has to be developed. Typically, coronaviruses do not have that exact same kind of shift. So we're hopeful that the vaccine that we're using now will continue to be effective. But that is really going to take months before we'll know for sure.
All right, finally, doctor, we've talked about what's happening in the hospitals and the decrease in cases. Finally, what do you need the public to know right now as we do see the decrease in cases and the reopening up of the local economy and the local businesses, where we would assume more people will be outside and taking less restrictions than we were before?
Well, I'd like to say that it's very nice to see that the positive rates have come down. I think that is directly related to the fact that we've gotten past the holidays. And so what we don't want to see is people coming back together in large gatherings and increasing the risk of spread. yet again. So wearing the mask is still going to be critical, avoiding those large gatherings, even if you're vaccinated, although obviously that's going to provide some protection. I think we are really at a very critical and important point. We kind of can see over the horizon a little bit. The rates are coming down in our region. Things are opening up a little bit. The vaccine is beginning to be distributed. We have an opportunity right now to try to really come together as a community, do the right things for the next few months, and really make a dent in how widespread this infection is. So what I think is most important is people just need to take the vaccine when it's offered to them, when it's available. Don't have hesitation about its safety or its effectiveness, and continue to use precautions, wearing a mask, avoiding those large gatherings. And if we can all sort of pull together for a few more months, I think we can see a significant difference.
All right, Dr. Scalzone, thank you so much for joining us today. And viewers, we'll have more next week on the vaccine and COVID-19. And if you have any more questions regarding either of those two topics for our local experts, you can email us at news@wetmtv.com. We'll have more on the fight against COVID-19 and the rollout of a vaccine on 18 News and on mytwintiers.com. Thank you for joining us and have a good night.